Hi, I'm Dr. Dejesus,
My name is Keith Murphy.
and we're going to be talking to you about navigating barriers, how to advocate for a loved one with a substance use disorder.
Why are we talking about this important topic? First thing is to affirm humanity, remove barriers, increase help-seeking behaviors, increase recovery capital, and ensure access to ethical, reliable, dependable, substance use disorder-centric services.
Somewhere on the edge of consciousness, there is a mythical norm, which each of us within our heart knows that is not me. In America, this norm is usually defined as white, thin, male, young, heterosexual, Christian, and financially secure. It is with this mythical norm that the trappings of power reside within society. Those of us who stand outside that power often identify one way in which we are different, and we assume that to be the primary cause of all oppression, forgetting other distortions around difference, some of which we ourselves may be practicing. And that quote is by Audre Lorde.
And falling outside of what is usually defined as white, thin, male, heterosexual, Christian, and financially secure are those of us who fall into a marginalized identity. And some of those identities include women, people who are LGBTQ, people of color, people who don't identify as Judeo-Christian, people with felony convictions, people who are homeless, people who are undocumented, and people with learning disabilities, and people without access to wealth. And in that group of marginalized identities is also the group of people who have or who suffer with substance use disorders, or people who are in recovery fall into that marginalized identity or population. And if you think of marginalized, it's those people who fall outside of the margins of what is considered the quote-unquote the norm, or those who are the healthiest.
So when we're talking about these populations, these marginalized populations, we're talking about partially about ableism and how that impacts and how we as a society view people who are outside of this mythical norm. And one of the things that people who exist outside of this mythical norm experience is stigma. And if we talk about what stigma is, it's a mark of shame or discredit. It's a way that society characterizes people, or it can be something that's a diagnosis or a sign of disease. And there's often shame that's associated with stigma, and oftentimes, particularly for people with substance use disorder, there's blame that comes along with it.
What is discrimination? Discrimination is also another form of stigma. And discrimination is simply defined as treatment or consideration of or making a distinction in favor of or against a person or thing based on the group class or category to which that person belongs, rather than on the individual merit. So basically, discrimination is action taken towards or against people based on a prejudice or an attitude or belief. That's usually unfounded.
And when we talk about ableism, which we brought up a few moments ago, what we're talking about is a prejudice plus power. So anyone who has any degree of physical or non-physical ability can have or exhibit some ability-based prejudice. And in North America and globally, society really breaks people down into the abled and the disabled or non-disabled. And so with ableism, there's institutional power and there's privilege, as well as discrimination, exclusion, and also what we talk about is we normalize people who have an abled status, right? And so what that means is that anything who is outside of that abled identity is other, is stigmatized, is discriminated against. And so this is what we wanted to talk a little bit about today.
And even to echo what Christine was saying, it's the idea too that one who, when you think about ableism, it's the idea that those who are physically able or have the ability to do other things are better than. It's the idea that someone who is less able is less than, and everything is geared towards those who have, who are quote unquote healthy or able to do certain things. So society is generated and created for those people.
And when we talk about why we're talking about this is substance use disorder is a medical diagnosis. And I think sometimes as a society we forget about that. And so that because this is a medical diagnosis, people who have who have a substance use disorder are protected under the law, under the Americans with Disabilities Act and under Section 504 of the Rehabilitation Act of 1973. And when we talk about this and the way the laws are written, it's written for people who have an addiction. That language is sort of passé, and we're really more talking about what we call the substance use disorder, because that is what is the medical definition, and that is what makes people eligible for resources and services.
Yes, and even understanding a substance use disorder is based on a continuum. It's not like every case is so severe that everyone falls into the place where they need active treatment or even recovery. It's understanding that there's a progression. It goes from mild, moderate to severe, depending on the criteria and the number of symptoms this person is demonstrating based on their substance use. The other part of it too is to understand, when we talk about ableism with the substance use disorder, it's usually a binary track. That's why I talk about the severity, and that either someone is healthy or unhealthy, well or unwell, rather than seeing health and wellness on a continuum. So people are either accepted or not accepted, and usually, and if you're watching this recording, what you're beginning to understand is that the system is harder to navigate for those who have a substance use disorder.
And who society really deems as unwell.
Right.
The thing is, one can have a substance use disorder and be quite functional and not need any resources. And then people can also be very functional but need resources, right? It's not a dichotomy. This is not a dichotomous relationship. But it's about understanding what people's needs are and how the laws can attend to those needs.
Right, and in recent times we're seeing a debate between those who are worthy and unworthy. And again, if you're watching this, we are presenting with the idea that everyone is worthy and deserving of adequate, reliable, and dependable health care and treatment. So that's the part whereas we're hoping to really shed some more light on what you can do to help advocate for your loved one.
And as Keith and I have worked together and talked over the years, what we've realized is that some of these laws are written from an ableist language. That these laws aren't always inclusive of everyone. And so we want you to understand just a little bit about the resources that exist and how you can access them, and how it's really important that you should be asking questions as family members along the way of how you can support your loved one, how you can get them resources that they need. So in the United States, only an abstinence-based recovery is covered under these laws. Now, that doesn't mean that someone who has a substance use disorder may not be able to get other services, but it may not be under the diagnosis of substance use disorder. It may be under a co-occurring disorder. And how do we help people navigate these laws in terms of policies with substance use disorders is a discussion that really is something that's beginning in the United States.
And part of what the work we're trying to do is be able to name this, because oftentimes you may have run into this issue and not have a name or been able to understand why even those in the helping profession have actually set up or created barriers to stop you and your loved one from getting the help that they need and deserve. There are a lot of different factors, and some of them may be legitimate concerns. However, it's the understanding that there's an ableist mindset that you and your loved one, or even you yourself, may be an inconvenience. Why are you asking for these quote-unquote accommodations when you're just asking for what the law says that you're allowed to have, and you are entitled to all the protections and everything that someone who doesn't have a substance use disorder can get based on who they are as a person.
And so part of what we want you to do is help you take a step to understand the laws. And the laws are quite complicated. I mean, it took us hours and hours to just sit and sort through them. So we don't expect, and we're not going to tell you, oh, this is this and this is that. You're going to have to sit down and ask questions. But who do you refer to services for, right? We want you to be thinking about who is best able to help you. Is it a mental health provider? Mm-hmm. Is it a physician who's going to be able to best help you? You really need to understand who your resources are and how to access them and how they can help you navigate this system. Sometimes it's in a school district, or Keith and I both work in collegiate recovery, right? Sometimes it's going to be a disability service in the school. So you're going to have to do some research about who can access services and how they can help you network and get those services. you should be asking what kind of documentation do you need for diagnosis. And again, that's going to come from different places. Perhaps it's going to come from a treatment facility. Perhaps it's going to come from an IEP. There's lots of different places in where documentation is going to be needed. But inevitably, in order to access these services, you do need to have some documented health diagnosis.
That's correct. And knowing also, too, not going beyond just the diagnosis, is that someone dealing with a substance use disorder is not just that substance use disorder. They have many, many layers of needs and wants as it relates to the substance use disorder, but there could be other mental health concerns, other physical concerns that could be going on, because we understand that, one, a person dealing with a substance use disorder, and even their families, they're, on some level, they're dealing with someone who is impaired and not in a great place to make really healthy or the best decisions. So for me, it's often ironic that a person who is often impaired by their substance use has to call their insurance company, has to know how to navigate different arenas and different types of people in order to get the treatment that they so desperately need. And in some cases, they've even paid for it. But that speaks to more of the ableist culture that we run into.
And what we know is, in terms of under substance use disorder, a person has to actually be in recovery to access most of the services under that diagnosis.
Right.
Interestingly, when you have another diagnosis like a co-occurring depression or anxiety, that doesn't require you to be in a well state. And so it really is about understanding sort of your loved one, where they're at, and how you can utilize the system to access services. And what accommodations people will need. So sometimes a person is in recovery, they've had a traumatic brain injury, they're going to need some resources in terms of the traumatic brain injury as well as their recovery. Sometimes they're still in a phase of active use, but they need resources, let's say, in terms of a living situation. We may not be able to help get them access to resources under the substance use diagnosis, but we may be able to help them access resources through a mental health diagnosis or a physical diagnosis. And so it's about understanding the complexity of the human being that you love and understanding how we can best help them and utilizing the system that exists, even though it's flawed. I mean, it is definitely flawed. But understanding that and moving forward.
And to pivot off of what Christine was saying, the other piece of it is advocacy, and on some level being an activist. And lots of times, most people are, if they're dealing with someone who's got a severe or persistent substance use disorder and have been in and out of treatment, being an advocate is very, very hard to do, because so much of emotional, physical, mental, and financial resources are geared towards helping this person to get better. Oftentimes, in that storm of life, they miss that there are other families out there who are available to them. They miss other free resources that are within their community. And even beyond that, it could be where they live. Someone could be in a rural location and not have that much access to other people who are dealing with a substance use disorder. Thankfully, currently our federal government and even our state and local governments are looking at providing not just financial resources, but backing recovery centers and other places for people who don't ordinarily, think this way and consider or think about substance use disorders and recovery. And, we do this 24/7, but there are other people and families who think about it and consider it, but when you're in the throes of trying to get someone help, advocating for yourself is really, really a difficult thing to do.
And so when we're talking about advocating for the self, we're talking about engaging in family supports, which is why this conference was even created, right? Because not everyone has access, particularly if you're in a more rural area, if there are financial limitations, it can be really challenging. So part of advocacy is self-care, and doing that piece for the family so they can be in a place of wellness to be able to have the skills and the emotional energy to advocate for their loved one.
That's correct. And having a real base of knowledge, too, about substance use disorders, knowing that it is a chronic disease, knowing that, sometimes reoccurrences with the use of chemicals can happen, knowing that harm reduction or other health promotion strategies are available, knowing that medication-assisted therapy or treatment or recovery is available. Lots of times, people are ushered into an ableist model of an abstinence-based recovery when that really doesn't suit that person or that family or in their particular needs and where they're at. And knowing how a substance use disorder works in terms of what substance was taken, how that person may be impaired, may be also the best way for you to advocate, because then you can speak to possibly what that person or that loved one that you know or that person that you do know or are trying to advocate for, what they actually need.
And I think you're bringing up a beautiful point there, Keith, in terms of these other methods of finding recovery, right? Things like psychopharmacological interventions. So things like medication can be really helpful to people. We do a lot of stigmatizing.
Right.
And when we stigmatize, we actually stop people from getting the help they need.
That is correct.
And so, again, it's about taking the time and the energy for you to take a step back and not engage in this ableist mindset as well. Because what we know, the research is really clear, right? There are lots of paths to recovery.
Right.
And if we're coming from this one way, we miss opportunities to get our loved ones well and healthy. We have a good friend, Devin, who has a very concrete saying, and he says, dead people don't recover. And so we need to understand that harm reduction is part of that recovery process.
Right, and it's part of that larger conversation. And, maybe 20 years ago, 25 years ago, resources were available, but they were few and far between. But the internet has kind of made things a little bit easier for people to find and make those connections that are necessary. And even on Facebook, there's so many different groups and people who are actively talking about and engaged in the conversation of recovery in light of the opioid epidemic. But what we are seeing, it's not just the opioid epidemic, it's a conversation about active addiction, because still we understand that alcohol is still the number one problem. Nevertheless, using opioids as this current trend and current vehicle to really talk about and push recovery like it's going up to a national level. So there are a lot more resources and things available to people than what was available, again, 15, 20 years ago.
And it's important that we understand that as humans, we're complex beings, right? There's not one simple answer that fixes it for everyone. And so you really have to understand what you need as a family and what's going to help your family move further towards health, right? Because health is really, and wellness is about a continuum. It's not a destination.
Right.
It's a continuum. And so you have to know what you need and you have to understand your rights. And then when you can put those two together, really, that's the recipe for advocacy.
That's correct.
So things to consider.
And in dealing with many people, even those, again, in the helping profession who have oftentimes the best intentions in the world, there's still things to consider, especially when working with your loved one or the person that you care about in terms of getting them treatment, is, one, what hours are services provided? Because we know that oftentimes, addiction doesn't work on our calendar or on our schedule. Things pop up that are just beyond inconvenient. And when we look at the disease, we understand that it's a life or death situation. And oftentimes, many places keep office hours or business hours or bank hours in terms of helping people get the treatment that they need. The other things that we often think about and consider, and we talked about this earlier, are how complex people are on their own, apart from dealing with a substance use disorder. So we want to get the full breadth and understanding of what services are being provided. And if someone is pushing you down just one avenue and not offering you reasonably and responsibly other areas or other ways of treatment, that's a place for you to begin to advocate and stand up and push back against it, or even leave that place, because oftentimes you may not have the energy or the resources to change an entire system. The other thing to really consider is one, like I just mentioned, is abstinence-based recovery requirement for services. And that's one of the things that we also found out about the American Disabilities Act, is that in an employment situation and in other areas, what they're looking for is that someone actually, in order for them to engage services that may be provided by the state or the federal government, they have to already be in an abstinence-based program. And a relapse or a reoccurrence of chemicals can actually cause them to lose some of those protections. And that, to me, it's a little bit sad, and it's really ableist, and it's really shaming, because there's no other illness or disease that says, you know what, if you're not well, you can't get the help or the services that you need or the protections from the federal government.
I mean, imagine if we told a person with diabetes, oh, you ate some sugar and now you can't get services. It just doesn't make sense, right?
Another thing to consider is where services are provided. One of the things to think about in that respect is just, one, the level or transportation. Is transportation accessible for someone who is going to treatment or looking for treatment? And that could be basic treatment. It could be just across town. It could be another part of the county, it could be in the county. What benefits, and if you have benefits or insurance, what types of, is that covered in Medicaid, Medicare, are you able to get your transportation covered by, let's say, even by an Uber or something like that? One of the things that I've noticed is that certain hospitals will pay, or certain treatment places will pay for Ubers for people to get to and from their treatment, not related to substance use disorder, but often other times other diseases or other ailments. And the other part of it, which is really key, is just in terms of accessibility, in terms of transportation, lots of times the expectation is that people should be able to get to wherever their provider is, and that may not often be the case. Oftentimes we're dealing with people who as a marginalized identity, they don't have access to wealth, or not even wealth, but resources in order to pay for transportation, or even know someone with a vehicle or a reliable vehicle that can take them back and forth. Oftentimes people who, let's say methadone, have to go to a particular place in order to get methadone, and it's usually early in the morning before work. People usually aren't allowed to get take-homes when they're first starting out on methadone, because one's the idea they're going to misuse their methadone treatment or go into diversion, as they say, in terms of like spitbacks or other things. So the access to other types of treatments usually aren't accessible or easy for other people to get to. So again, combating the ableist language and culture is very, very important.
And can you talk a little bit about having to have an abstinence-based recovery, Keith, and why that can be ableist?
Well, having an abstinence-based recovery is often, going into abstinence is often a barrier for people to get better and get well in the first place. So if we think about, we're saying to someone, hey, you need to put down the chemicals in order to get the services that we have to offer, when the chemicals are the thing that's allowing that person to be able to survive and deal with the world as it is. So you're asking them to give up the one thing that gives them a sense of hope and strength, believe it or not, to deal with the world. So we want to strip them of that substance that they're using, and then tell them to engage in treatment, which is a new and scary and terrifying situation. And then God only knows what things that may bring on, like a trauma that hasn't been addressed, or trauma that hasn't been worked on. And people understand their bodies have gotten used to having this substance in their life. So we're looking at acute withdrawal could be a possibility, and other types of, not even so acute, but just withdrawal and just being more just impaired going through withdrawal when the substance is removed. And that in and of itself is the first, for many people, is the first barrier. And that's not often, and it's not really fair.
And I think when we talk about things like medication-assisted recovery, people often think about that as not being abstinence-based, when that in fact is not true, right?
Right.
Can you talk a little bit more about, I think we were talking earlier about sober living and how that is often plays out in sober living.
Oftentimes, sober living, there was a law that was passed in New Jersey not too long ago that said people who were in sober living had to accept people who were taking medication as a part of their treatment or their recovery. We think about it, and even in the ableist language of saying medication-assisted therapy or recovery, we don't say someone who's taking a sedative or benzodiazepine for anxiety is involved in medication-assisted therapy. They're just saying, oh, we're taking X medication for anxiety. We don't put them in a particular class as saying that they're totally different than anyone else dealing with a mental health issue. We don't say someone who's taken Risperdal to deal with depression or anxiety, oh, they're involved in medication-assisted therapy. So it's the same thinking in terms of someone who is dealing with a substance use disorder to be able to have methadone, buprenorphine, whatever, Vivitrol, those other things, in order to be able to stay in sober living. So that was a barrier, and that was ableist, because the expectation, and sadly what's often said as the gold standard, was abstinence. And that's not really fair in understanding where people are in the continuum of health and wellness. And it doesn't serve anyone. In fact, what it does is that it sets them up for future failures. And it goes back to the idea of being either well or unwell, or clean versus dirty.
Right.
Or alcoholic or not, or addict or not. It's just, it's a binary system that doesn't really fit our current situation.
And I think that's where harm reduction really comes in, right? So with harm reduction, it's about a path to wellness.
Right. Right, and even the idea of, let's say, harm reduction as a phrase in and of itself, it's saying like that person doesn't know how to not harm themselves. And rather than even seeing they're using as part of a health promotion strategy, it's something that they're doing to help themselves be whole. And that's also part of changing the ableist language that we use, because we're so used to shaming and punishing people that we don't consider like, well, how is what we're saying not allowing someone to actually get into treatment or into recovery?
It's funny, I often will say to people, no one wakes up one day and says, I'm going to develop a substance use disorder. This is exciting. What happens is that human beings, we try to minimize our pain.
Right.
Like, that's just how we function, right? No one wants to feel discomfort. No one wants to feel pain. And so when someone develops a substance use disorder, it's not necessarily about them being, it's not at all about them being good or bad, right? It's about, there's some pain that I'm trying to manage in my life, whether that's a physiological pain or an emotional pain.
Right.
And so when we take a substance away, now we have to feel.
Right.
Now we have to experience these things that are really uncomfortable and sometimes traumatic to deal with, right? And so when we think about harm reduction, we're talking about people moving towards wellness, but it's causing them pain to get there.
That's right.
And so we really have to be thinking that this is not a dichotomous relationship. It's not all good or all bad. It's not abstinent and in recovery or not in recovery, right? It's a continuum of wellness. And when someone is working towards reducing behaviors, that is a movement towards wellness.
Right. And it's, again, because so much of our ableist language surrounding substance use disorders has to do with being punitive and criminality. We kind of have kept that going. Like, we need to punish the person who's dealing with the substance use disorder or trying to move into recovery as this person who's a bad person, who's done bad things, in order to require or acquire the substances. So we have to make sure that we keep our foot on their neck in order for them to kind of get right and do right. And that's really denying them their humanity.
And realistically, we know, as people who work in higher ed and in the field of psychology, punishment is not an effective way to make behavioral change, right?
That's correct.
It just doesn't work out. And so when we're thinking about this...
Or long-term and lasting change.
Correct. Short-term, but not long-term and lasting.
Right.
And that's what we're talking about with recovery, right? Long-term, sustained recovery. We want people to be in a place of wellness.
Right.
And so if we're talking about how to help people and how to support our loved ones and not be ableist, we have to move away from that.
Right. And even on the language that we're using could be stigmatizing and damaging, but also being aware of how they're being treated when they move into these different arenas and different spheres when they're looking for the help to change.
Right, and I think that's such an important point about the language in which we use, because we know that words like addict actually prevent people from getting the help they need, right? It puts on the shame and the stigma of this identity as if this person has done something bad versus having an illness, right? We don't blame someone who has a heart attack for making poor choices and you don't deserve care. No, we look that they're in a place of crisis and we move forward to get them well.
Right.
And it should be the same thing for people with substance use disorder. And when we're talking about being ableist, we need to remove that shame. We need to remove that stigma. We need to really remove that language to help them find that wellness.
Right.
And it makes me also think, too, as family members, sometimes it can be a little challenging dealing with a loved one. I think it's often... That's actually probably an understatement of the century. But I think when we're dealing with a loved one who has a substance use disorder, it can really be scary and overwhelming. And I think we often want to step in and take control and make things better.
Right.
And certainly I know as a parent myself, I don't want to see my child in pain or in harm's way. But for many of the people who we're talking about, these are full-fledged adults, 18 and over.
Right.
And so our desire to limit their pain and to get them well doesn't, we engage in ableist behavior if we're taking away their autonomy.
That's correct.
Right? And so we need to be able to let them make decisions on their own even when they're problematic and scary for us.
That is correct, yeah.
Which is so hard to sit with, right?
Yeah, it's uncomfortable.
It's really uncomfortable. And that's part of that work that you were talking about earlier about us as family members accessing services, right? That we need to be able to sit with our discomfort and our pain and the stigma that we sit with and allow that to be a thing on its own so it doesn't put that ableist stuff onto our family members so they can do that self-care for themselves.
Right, and it's moving away again, from the ableist idea, and that's really embedded in our culture of the idea of being cured or uncured, the idea that we carry, the idea of being rich or poor. You know, it's those, getting rid of those binaries and seeing how people are moving on a continuum of health and wellness.
Absolutely. And so I was wondering, we were talking about health and wellness and language and disabled identities, right? Because I don't think many people who have a substance use disorder would consider themselves disabled.
Right.
And yet we know that this population is eligible for services under the ADA.
Right.
And so I'm wondering if we can talk a little bit about what that means in terms of how we move forward and how families move forward as they're finishing up this video.
Well, I'm going to end with at least my part here, with a wonderful quote by Stella Young, and it says simply this: "We are more disabled by our society than by our bodies and our diagnosis." So I'll read it again, just for impact, is "We are more disabled by our society than by our bodies and our diagnosis." And what that means to me is simply this, is that society shames us and calls us defective more than what, and does more damage than what our actual diagnosis or disease does to us. And that's the thing that oftentimes stops people from getting help and assistance that they need. And one of the things I'm guessing that so many people run into is we're in this weird place of transitioning from looking at people with substance use disorders as criminals as to sick people who need help. And moving away from a culture that moralizes and treats them as people who continually make bad decisions because they're just pleasure seekers who don't know how to stop. Not looking at and understanding that people are in this compulsive, dynamic relationship with substances and how it changes their brain to the point where they can no longer stop their use and will do anything within their power to continue using, and despite all the consequences. So understanding that is really the launching point to helping, you know, our society and our loved ones begin the process of healing. And that opens up more doors for people to get better, because then I'm not seen as something that's horrible to deal with. I'm just a person who's sick, who needs some help and assistance. And
so when a person is in that place, as family members, how can we support them, not being ableist, but to move forward? How do we help people access the support services they need?
Well, I think, again, the first thing that we often talked about here is recognizing and understanding ableist, the language, and the barriers that are set up for people, like, you know, the convenience of times, you know, the access of treatment in terms of transportation, not knowing what laws will stand up for you and which ones don't. And sadly, you know, laws are set up, you know, and they're supposed to be colorblind, gender blind, and blind to someone's ability or impairment, but they're not. And some people who have more things, obviously, or more access to wealth and power, get treated better. But in this case, this is a situation where knowing those dynamics and knowing, you know, what someone is entitled to can help push someone over the edge and into better treatment and into better. And what we're about is better health outcomes.
That's right. And I think one of the ways we can help people access those is really by knowing information, right? So participating in this conference is one way that people are gaining information, utilizing groups available on the internet, using online recovery supports, because if people are in communities that are remote, it can be pretty challenging, right? And so really understanding what the resources for families are, and then presenting them to our loved ones who may need these resources. I think it's really important, as we're talking and as we're closing this process down, is talking about being respectful of the person and their autonomy.
Oh, yeah.
And understanding that when they're ready to make change, they'll make that change. We can certainly present options, and we can present resources, and we should present resources and options, but we can't make someone get help before they're ready to get help, whether they have heart disease or diabetes or a substance use disorder.
Right.
So I think that's what we wanted to talk to you about today. If people are looking to reach us and get some more information about ableism and substance use disorder, they can maybe send us an email
Yeah.
I can be reached at KRISDEJESUS gmail.com, and you can be reached at where?
At Keith, KEITH. Murphy @Rutgers.edu. And Rutgers is spelled RUTGERS.edu.
Thanks so much for tuning in.
Thanks.